Menopause is as individual as a person's own genetics when it comes to the symptoms and effects on the skin. Perimenopausal skin changes are experienced by women who, from the age of about 45 years, begin to undergo high and low erratic swings of estrogen as their ovaries become exhausted. Menopause is a period of particular interest regarding skin biology and treatment. This milestone in women is medically defined as 1 year of no menstruation. In postmenopause, all the estrogen production is derived from peripheral tissues, primarily from adipose tissue. We know that all skin cells are shown to have receptors for estrogen and other hormones, which is an indication of the vital role that these play in the healthy functioning of skin. It is the decline of these hormones that results in the shutdown of hormone receptor systems. This results in the changes experienced by women pre, during, and post-menopause. Typically, the changes include dryness and hot flushes in addition to thinning skin, loss of volume, lines, and wrinkles.